Hello, Miss Smith. It's Kathleen. The nurse asked me to come in and take your blood pressure. Okay? I'm going to get the equipment and we'll get started. You'll notice for equipment, you're going to be using a standard blood pressure cuff. A lot of your facilities now, of course, use electronic equipment, but for testing purposes, you don't have that option. You must use manual, okay? So you want to make sure that you understand how the equipment works. This is what we call a teaching stethoscope. So realize that the evaluator is going to be listening at the same time you're doing your blood pressure. One of the things you want to make sure of is that you clean these off very good. You want to clean the ears as well as the bell. Those are steps that are very important when you're taking the blood pressure. You're going to use alcohol swabs. This is your standard blood pressure cuff, and so we're going to put this on. One thing you want to make sure of, when you place this on your patient's arm, notice that it has the arrows. Many of them have that, and it lets you know where to place this over the brachial artery, and that's real important. So we want to make sure that you note that whenever you see me doing the demonstration. Also, when you're taking the blood pressure, you want to make sure that the arm is bare. You always want to take a blood pressure over a bare arm. Never ever take blood pressure over clothing because you're going to get a false reading when you do that. Also, you want to locate the brachial pulse. Now that's located in the inner aspect of the arm, right above the elbow. And so you want to find that because that's very important because that's where this bell is going to be placed in order for you to hear the sound. When we're taking the blood pressure, we're listening for the first and the last sound. Now you want to make sure again that the arm is face up and that the arm is bare. The first thing we're going to go ahead and do is clean off our stethoscope. So you're going to clean off the ears. And also, like I said, you have a teaching scope. So on test day, you may want to clean off the evaluator's ears as well. Usually they clean their own, but it's okay if you do that. Now, one of the things that's important, when you're taking a blood pressure, how you place these in your ears make a world of difference. If you don't have them in correctly, you will not hear the blood pressure. Let's say you're in the midst of taking your blood pressure and you make a mistake and you've forgotten something. Don't panic. Just take it over. You're allowed to say to the evaluator, I need to do a step over. Just do that step over and pick back up where you left off. The first thing I'm going to do after cleaning that off is actually put the blood pressure cuff on. Ms. Smith, I'm going to get you to slide your arm in here for me. Thank you. Now notice that this is her right arm. So this arrow that's here is going to go right over that brachial artery where I found that pulse, okay? So you want to put this on and make it tight around the arm, snug. Okay, you can relax your arm. Thank you. You want to make sure that you can see everything you're doing. Now we're going to make sure that the valve is closed, okay? And we're ready to take her blood pressure. You want to make sure these are turned inward, not backwards like this because you wouldn't hear anything. You want to make sure they're going inward for your eardrums. So you're going to put this in. You also want to tap it. If you can hear something when you tap it, you know you have it incorrect. Now let's place it over here. You want to make sure that's flat over that brachial artery. And now we're going to inflate the cuff up between 160 to 180 and slowly deflate and start listening. Slowly turn the valve toward you. You're in control. Once you hear that last sound, you want to release all that pressure off that brachial artery. One of the things I want to point out to you as well is when you're taking the blood pressure, if when you first start to deflate it, you hear a sound right at the 160, between 160 and 180, you want to deflate it all the way down, and then you're going to inflate it back up to 200 because that means that there's a beat that you may have missed because it's so high. So you don't want to miss any beats. So you want to make sure that you capture every sound. So you want to remember that, okay? Now we're going to take the cuff off. Thank you, Ms. Smith. You okay? All right. Let's take that out. Let's slide this off your arm. Thank you. Okay. All right. Now, here's your call signal. If you need us, you just give us a call, okay? Again, if you raise that bed up, you want to make sure that you left it in the lowest position. Prior to documenting our blood pressure, we're going to make sure that we wash our hands. And then, of course, we'll put our equipment away once we've cleaned it. That ends that skill.